Hi, my name is Jordana Guillén. I study medicine at Catholic University. My subject is medical English, and the topic I'm going to talk about is acetaminophen versus ibuprofen in young children with mild persistent asthma. Definition: paracetamol, also known as acetaminophen or APAP, is a medication used to treat pain and fever. It is typically used for mild to moderate pain. Ibuprofen is a medication in the non-steroidal anti-inflammatory drug class that is used for treating pain, fever, and inflammation. The acetaminophen versus ibuprofen in children with asthma trial was a multicenter, randomized, double-blind parallel trial that was conducted from March 2013 through April 2015. The study included a run-in period of 2 to 8 weeks, with the duration of the run-in period varying according to the severity of asthma symptoms at presentation and prior exposure to asthma medication. The trial was conducted at 18 sites in the United States. Children 12 to 59 months of age were eligible if they meet the criteria for receiving long-term step asthma control therapy.
Roper St. Francis House Calls TV.
When aches and pains have you running for the medicine cabinet, what do you grab? Acetaminophen or ibuprofen? Dr. Travis Wilkes explains how they work and which is most effective for your ailments.
Tylenol is acetaminophen, and how that works is that it works actually on the brain and the way the brain's interpreting pain. With ibuprofen or naproxen, it's actually an anti-inflammatory medication, so it's going to work specifically on the part of your body that's experiencing the pain. Injure your knee or something like that, then ibuprofen is probably going to be a better bet for you. If you have osteoarthritis or you have a headache, then Tylenol is probably going to be just as good. They're both equally good at decreasing fevers.
Anyone with liver problems should avoid acetaminophen, which should never be mixed with alcohol. And those with kidney and stomach problems should avoid ibuprofen. Ask your doctor if you have any questions.
These medications are great for short-term use, but if you're going to use them for longer than a week, then I really think you need to talk to your doctor and maybe look into some other things.
For more information, call 402-CARE, and for more House Calls TV, go online to rsfh.com. I'm Angela May.
Roper St. Francis House Calls TV.
Applications in medicine. Many children younger than 12 years of age receive acetaminophen each week, making the most commonly used pediatric medication in the United States. Observational data from both pediatric and adult cohorts have suggested an association between acetaminophen use and concurrent asthma symptoms and decreased lung function. Furthermore, a post-hoc analysis of a randomized trial on the safety of short-term use of acetaminophen versus ibuprofen for febrile illness in children similarly showed that the relative risk of unscheduled visit for asthma after the use of acetaminophen was substantially higher than the risk after the use of ibuprofen. These findings have led to much controversy, and even alarmed scientists have recommended that, until data supporting its safety become available, acetaminophen should be completely avoided in children with asthma.
How are children affected by asthma? Asthma can be seen in any people of any age group. Children with asthma suffer frequently from cold, cough, and breathing problems. Climbing steps, running, and playing also causes breathing problems. X-rays are normal in children with asthma. Some children may get asthma attacks frequently due to passive smoking. If there are smokers at home, small kids can get frequent asthma attacks. In 90% of kids, asthma goes away by the time they reach 10 to 12 years of age.
Pros and cons. Pros. We found no evidence that acetaminophen, when used during periods of respiratory illness, was associated with a higher risk of asthma exacerbations or other asthma-related complications than was ibuprofen. No deaths from any cause occurred during the trial. Cons. 6 serious adverse events occurred in the acetaminophen group and 12 in the ibuprofen group. No significant between-group difference were observed with respect to adverse events or serious adverse events.
Parents, if you've been avoiding acetaminophen because your child has asthma, listen up. Our partners at National Jewish Health found in a study the drug has no worse effect on asthma than ibuprofen. The research followed 300 children for nearly a year, and while you don't have to worry about acetaminophen, avoid aspirin altogether.
Still, we want to stay away from aspirin in children for a very different reason, and that's just simply a no-go in children.
Aspirin use in children has been linked to a rare and potentially fatal illness known as Raised syndrome.
Issues applying equally. Ibuprofen and acetaminophen have different mechanisms of action. It is thus highly unlikely that their use could be associated with similar increase in the rate of asthma-related complications that are known to be determined by different mechanisms of decrease. Regardless, the focus of our trial was not to compare these medications with placebo with respect to asthma outcomes. Instead, the focus of our study was to answer the important practical questions from clinicians and parents regarding which medication to use, acetaminophen or ibuprofen, when children with asthma are having fever, pain, or discomfort that necessitate treatment with an antipyretic analgesic medication. Conclusion. In conclusion, over the first year study period, we did not find that asthma exacerbations or other markers of asthma-related complications occur more frequently among children who were randomly assigned to receive acetaminophen than among those who were randomly assigned to receive ibuprofen.
Observational studies have suggested an association between acetaminophen use and asthma exacerbations in children. However, this association has not been rigorously examined. In the AVICA trial, 300 children 12 to 59 months old with mild persistent asthma were enrolled in a randomized double-blind trial comparing acetaminophen with ibuprofen as needed for fever or pain. In this factorial trial, patients were simultaneously randomized to cross over among 3 standardized asthma control therapies: daily inhaled glucocorticoids, as-needed inhaled glucocorticoids, or daily oral leukotriene receptor antagonists. The primary outcome was the number of asthma exacerbations that led to treatment with systemic glucocorticoids. Asthma exacerbations were not different between study groups. There was a mean of 0.81 exacerbations in the acetaminophen group and 0.87 in the ibuprofen group over 46 weeks, for a p-value of 0.67. Similarly, no differences between groups were detected in asthma control days, albuterol rescue use, or unscheduled visits for asthma. The authors conclude that episodic use of acetaminophen as compared with ibuprofen was not associated with asthma exacerbations or reduced asthma control in young children with mild persistent asthma. Future studies are needed in older children and those with more severe asthma. Full trial results are available at nejm.org.
Thanks for your attention.